Hi, welcome everyone. Thank you for joining Good Samaritan Facebook Live. And I have to start off by saying I'm happy to announce that we are not talking about just COVID because those numbers look very good. But we do have some wonderful guests to talk about another important topic as we start to move into topics around various different aspects of healthcare, and certainly this one touches everybody. Infant mortality is a conversation, and that is death of infants. Indiana, from a state standpoint, has been a poor performing state in comparison to other states over a number of years. I know I looked back at some of the information, and really over the last decade, we've had a little bit of improvement, but the United States averages, when we look at deaths per thousand lives, has been Indiana's been an outlier, but that's why you ladies are here today. And so I'll kick off with a few introductions. My name's Adam Thacker. I'm the Chief Operating Officer here at Good Samaritan, and I'm happy to have our two guests. And so we've got Cassandra DeBoard, who is our Safety Pin Project Director, and you don't have to know what that is yet because we're going to talk about it. And then we have Callie Cessna, who is our Perinatal Navigator. And so just to give everybody a baseline, why don't you tell us what the Safety Pin program is and how that program is benefiting the communities here in Knox County and surrounding counties as well.
Okay, so like Adam said, the state has been really striving to improve our infant mortality rate. And one of the ways they've done that is to push out some funding to local communities. So one of the funding opportunities is called Safety Pin, and the PIN in Safety Pin stands for Protecting Indiana's Newborns. So the purpose of that funding is to reduce infant mortality. And so we applied for that funding about a year and a half ago, and we're awarded the money. And so starting last April, we kicked off some of the components of our grant. And I'll let Callie talk a little bit more in a minute about her specific work. We have another person on our team who couldn't be here today. She's a perinatal peer recovery specialist, Sabrina. So she's another unique kind of position on our grant where, again, we're just really trying to support mothers who are either pregnant or have a baby with under the age of 1, and making sure they have access to care and just helping kind of resolve some of the barriers they might have to keeping themselves healthy during pregnancy and then that baby's first year of life. So again, that's education, that's prevention, that's just meeting some basic resource needs. But we have a couple different components within our grant. So I don't know if we want to go ahead and have Callie talk about what she does.
Yeah. And I think just to hit on one of the things that you mentioned is that when we talk about infant mortality, we're not just talking about a death at time that an infant's being born, but a lot of your work you're doing in advance to work with pregnant mothers to make sure that they're set up from a safety standpoint, from an educational standpoint, to make that day a celebration that we all want it to be. And the program has so many different facets, but you guys really tailor that to the moms that you work with based off of their needs. So sure, Callie, why don't you tell us a little more about the program?
So I'm the perinatal navigator. I work with all of our moms that do not have a substance use disorder. I see myself as more of a support system, so I can work with them on gaining access to education, access to housing, food pantries, basically whatever they identify as a need is what I want to help them with. And like you said earlier, we can personalize and customize this to them. And I think that's really unique about our program.
Excellent. And so with those mothers, and we may have some pregnant mothers that are watching right now and thinking, a first time pregnant mom, and there's more questions than answers a lot of times, or somebody that knows a friend or a family member. So how does somebody get involved with the program? Do they have to reach out? Do we have ability to identify maybe who's in need through our medical offices and other Good Samaritan aspects? So maybe talk a little bit about how our pregnant mothers in the communities can take part in this program.
So I'll say, as we've kicked it off, we've really worked internally with our physicians, especially our OBs or those family practice who are delivering babies. We've worked really closely with them to make sure we're kind of capturing moms as early as we can in pregnancy. So we have a pretty cool system set up at the first prenatal visit where mom comes in and says, I've had a positive pregnancy test. The provider there will essentially kind of screen the mom, ask her a handful of questions, and if there's areas where that mom identifies essentially needs, she'll say, you know what, we have a safety pin program. If you're open to that, we can pass along your information. And then Callie or Sabrina will actually reach out to that mom, usually within a day or two, and kind of get a better idea of what kind of support they may need, talk about how we can service them. And again, it's really unique, and we can text them, we can call them, we can Zoom them, we can meet them somewhere in the community, they can come to us. And so that's really how we've kind of launched the program. But now I think in the coming months, we're really trying to get out into the community and get more community-based referrals. So we have some meetings set up with Department of Child Services, PACE, the Family Health Clinic, and really trying to get more community referrals, so not just internal referrals. But even moms, like if they're on the Facebook Live today, they can email our program, they can call us. safetypin@gshbin.org is a generic email that they can reach out to, and we all get that and can kind of answer questions or give them more information.
Sure. So you mentioned meeting with moms after you make that connection. So where are you located? Where do those meetings occur?
So currently we're physically located on 5 GM, so up on the obstetrics floor of the hospital. But we meet moms wherever we can. So sometimes that's here. Sometimes we can walk over and meet them after their OB appointments just across the street and bring them over here for a space to meet. We've met them out in the community, so at the library, really whatever's convenient for them. We do have moms with barriers to transportation, so we don't want to add another appointment or another place that they need to figure out a ride to. And again, we assist with that. So we have a program, a partnership with Van Gogh, where we're covering some of those costs if that's a barrier, at least temporarily, and then really trying to build those supports with moms to say, like, okay, how can we get it to where you can make that call and make that appointment? You can then start paying for this. How can we help you resource so that transportation is not a barrier?
That's excellent. I know from Good Samaritan standpoint, we speak a lot about a care team, and you certainly are part of that care team and helping to knock down whether it's barriers to transportation, access barriers. Moms don't have to have a referral from a physician or qualify, even have insurance or payer. This is something that the state has recognized and is funding as a additional resource for our community. Are there additional safety pins throughout the state, or how has that maybe worked across Indiana since it's a statewide initiative?
Yeah, they've been putting out the funding for at least a couple of years now. To my knowledge, this is the first time we really went after it at Good Samaritan. I could be wrong about that, but definitely the first time I think we've been awarded, or at least at this level. So there are other community organizations, hospitals, I assume, who've received safety pin funding. With that, though, the way you could write your grant was kind of vague, so I don't think there's any other programs looking exactly like ours. And again, I said we have a team member who's not here. That's Sabrina, and I really am excited about her position. I think that's a pretty unique kind of new way that we're leveraging the peer recovery coach, and that is she's kind of the perinatal specialty. So Sabrina is a person in recovery. She has lived experience as a mom using substances, and she can offer support to moms who are finding themselves pregnant and having trouble minimizing their use or maintaining recovery. So that's just, I think, a kind of a cutting edge position we're kind of piloting here. And I know I've talked to some people at the state who said that's coming down the pike, but just not yet. So we're really excited about Sabrina's work. And again, I think that's one thing that kind of makes us unique. But there are other programs across the state focusing on infant mortality, of course, smoking during pregnancy, substance use during pregnancy, safe sleep, breastfeeding, those types of initiatives.
Excellent. Yeah, and I agree when we talked about the program and hearing that innovative approach, so much of helping moms with care and patients in general is being able to create that connection and meet patients where they are, wherever that may be. And certainly in Sabrina's role, having experience and being on that recovery path gives moms confidence that it can be done, and also is able to recognize that I've been there, as opposed to training, which is important, but that connection's even different on that level.
Yeah, we've talked about that a little recently, and she is a certified peer recovery coach. So there is a training process she goes through. There's a credentialing that she has, but really with her position and Callie's, we talk about. I really think they're just providing a lot of hope, which is pretty cool. So just moms who are struggling in whatever way that might be, just having two supports who said like, we've also struggled as pregnant women and new moms. And like now we're in a position where we can help you, like there's hope and it will get better. So I think that's a pretty cool thing that we're able to provide with these, the moms we're working with.
Well, you all are doing great work. I know it's a bit of a marathon rather than a sprint to see the impact, and certainly as we look at the impact from a overall data standpoint, it takes time to see, okay, are we having the impact? But you're having an impact on the patients that you engage with, certainly on a day-to-day basis. Any additional aspects of the safety pin program or elements that you want to make sure to communicate?
I have a little bit, but is there something you wanted to talk about?
I just wanted to say like how unique our program is and the fact that moms can directly reach out to Sabrina or I through text or phone calls. So we have our work mobile phones. So it could be whatever time of the day, they could send us a text, say, I have a question about this, or I just lost housing, or I don't have food for this weekend, or I'm just having a really bad day. Can I have somebody to talk to? They don't need to schedule an appointment. They don't need to go through an insurance process. They can just show up and be here, and we can be there for them. And I think that's really unique and special about our program, that we get to make moms feel like they are the priority and we are here for them, if that makes sense.
Absolutely. And just again, thank both of you and Sabrina and the whole team working on this. It was quite an effort even applying through the state to be recognized for the safety pin, but then also to put together what is a new novel approach and finding innovative ways to connect with moms and have that impact, and then just that availability and being that person on the end of the phone that can help them deal with whatever may come about.
I think there are some challenges when it comes to being funded by grants. They can be temporary, or it's not as black and white. But again, because we're not billing at this time, we do have a little bit more freedom probably than some of the other providers. Just we don't have to schedule appointments. We're just really able to be there for them at this time. And the only other part I was going to mention is within the grant, we also have convened a maternal and child health coalition. So what that is just trying to bring together any local service agency that serves mothers or infants. So you might think of like WIC, local churches, the health department, the hospital, of course, really trying to bring together those groups of people, because we all probably have the same vision and kind of the same goals in mind. So we're working with some partners at IU, and they're walking us through a program called Strategic Doing. And so really it's very much like strategic planning, but you just start doing at your first meeting. So you're doing you're chipping away at the problems bit by bit at each meeting. And so that's been a pretty cool process to see come together. I think we've met like 5 times as a group now. And I did just want to mention that in case there's anyone else out there on Facebook Live today that would want to get involved. It's open to anyone in the community, whether you're an individual who's just interested in this kind of particular population, or you're an organization serving this population. We'd be happy to partner with you.
And if that were the case, they could email the safety pin at gshvin.org
Yes.
to kind of make that connection and ask questions about how to be involved.
Yes, and we've worked with Clint to get safety pin up on the Good Samaritan website. So I think that should be soon. If it's not already, I'm not sure. So we should be out there for them to get information up there too.
Great.
Yeah.
All right. Well, let's see if we have any questions from the audience. And I'm getting the nod that we do not have any questions. So in closing, certainly this is a very important healthcare topic. As you look at infant mortality, it's considered the number one indicator of the overall health status of a region. And the work that you all are doing is tremendous and impactful on a patient basis, on a larger scale as well. So we certainly thank you for for all that you are doing, and would ask anyone who wants to get involved or think there may be somebody that would like to be involved, share the information from today. This session is recorded and will be available on our Facebook, and then certainly can engage further with either Cassandra or Callie. If you send it to me, I'm just going to forward it to them. So send it to safetypin@gshvin.org. And we thank everyone for attending.
Thank you.
Yes, thank
Have a
you.
good day.